let us start with first question, and let me see. I'll give you 45 seconds for this, all right? And these are some really interesting questions which you will thoroughly enjoy today. I'm getting around 50% of you giving correct answers. That is a real good number. But I want it to be increased to 80%, right? Guys, assess for yourself, how can I achieve those 80% of the target? 47%, that is even less than 50% of you giving correct answers. Not an issue. We will look at this question, but I'm going to start one more poll, right? Yes, Dr. Dharmendra says मेरे senior के साथ same case हुआ था. This particular question carries so much weightage, so much importance in our day-to-day practice, right? The same question, I mean, same options will be there, guys. Options will be same, but I'm going to start a new poll with the thing that I'm going to tell you about right now, right? Which is the most common complication, right? Which is the most common complication while inserting central venous catheter, right? While inserting central venous catheter. Write down which is the most common complication. I'm starting the poll. Same questions. I mean, the question is different, but the options are different, right? I'm starting a poll, and this poll is gonna be counted. All right. In your final assessment, this poll is gonna be counted. So, which is the most common complication while inserting central venous catheter? Which is the most common complication while inserting central venous catheter? All right, so time's up. So 41% of you were able to give correct answers, guys. Did you notice the difference between the two questions, right? One was asking about the probable diagnosis with the help of the complications which are mentioned, and one is regarding or with relation to the procedure, right? What is the most common complication? First, let us discuss this, which is the most common complication that you encounter when you are inserting a central venous catheter. So this is what usually happens, right? Which is the most common site? It is the internal jugular vein, right? Itna clear hai? Coilocyte is also telling that मेरे senior के साथ हुआ था 2 बार. Wow. So look at the importance of this particular question, and this is a question which was asked, guys. FMG में ये question पूछा गया है. So most common site or most common vein to be inserted for CVCs, internal jugular vein, right? We prefer right side because it is easy and straight and easy to go, right? So a catheter hai, it is being inserted like this. You are able to see, everybody is able to appreciate, right? Most common this. Second one, that we go ahead with the right subclavian. Okay? From here you can insert the catheter and it goes into the superior vena cava. Okay? So what is present just behind this internal jugular vein? What is this structure going just behind this internal jugular vein, right? Which is the structure which goes just behind this internal jugular vein? Exactly correct, right? It is a carotid artery. And what about this? From the subclavian artery, oh sorry, subclavian vein, which artery goes behind that? Yes, subclavian के पीछे कौन सी जाती है? It is subclavian artery, right? So just adjacent to your vein is the artery, right? Carotid and your subclavian artery, just adjacent to the both the veins, right? So whenever you are inserting a needle, right? Whenever you are inserting a needle, high chances are there that the artery can get punctured, right? So most common complication is arterial puncture. Are you getting the difference, guys? Most common complication is arterial puncture. ठीक है, इतना समझ में आया? Now let us come to the second question, which was while securing central venous catheter, right? It is internal jugular or subclavian, right? It is not mentioned, but they are just securing the CVC. A patient developed high airway pressure. Normal airway pressure से pressure increased, right? Resistance, airway resistance was there, and there is sudden desaturation, right? So what is happening? What is present here? I'll just clear this diagram. What is present here? Yes, which structure is present here? Lungs is present, right? Lungs are present on both the side. So if you are inserting, what can happen? The dome of your lung or the apex of your lung can get punctured. You know? So if you are inserting the needle and there is this lung puncture which happens that we call, what can happen? The air can get sucked in here. So what will it lead to? It will lead to air in that cavity, thoracic cavity. What do we call it? We call it pneumothorax, right? Pneumothorax. So pneumothorax is a very common complication which happens, right? Apart from arterial puncture. But when this complication happens, the pneumothorax findings all of us know. Yes, medicine में पढ़ा है. There is increase in airway pressure, resistance is increased. You won't get air entry that side. Therefore, there is a common practice to go with X-ray after you have inserted the central venous catheter, right? Why? To rule out pneumothorax and to see the correct placement of the catheter. Both the things. So correct answer for this is pneumothorax. Clear hai? Dono question clear hai, guys? This is a question which was asked previously and very important one. It happened in our hospital as well, Dr. Jesse says, right? Pneumothorax, yes, Manisha, that is the way forward. Air in injection, yes, because of that air in that injection, high chances that it can cause pneumothorax. D, air embolism. Air embolism can happen when, yes, Imran, when can air embolism happen? And when air embolism happens, first thing to happen is EtCO2 goes down, right? Next, you get hemodynamic disturbance. Hemodynamic disturbances happen, right? So you will get most of the time bradycardia, arrhythmias, everything will happen. So you will get a picture which is relation to your hemodynamic and EtCO2 disturbance, right? Here what you are getting the picture relation to your RS, right? Increase in airway pressure, airway resistance. Agar tension pneumothorax ho gaya, to it is an emergency. All right. And yes, air embolism, as Chandrika says, it is most common in the surgeries above the level of the heart, that is of the neck or posterior fossa cranial surgeries. Okay. Everybody understood these questions? All right. So we are moving on to the next question. Manisha has some doubt. Let me see. Sir, embolism, I'm not able to read your question here. Sir, embolism can also occur in CVC. Yes, embolism can occur in CVC, but most of the times it is not that common because the veins which are there, when it is open, you generally have a syringe attached to it, right? So when you have a syringe attached to it filled with water, after that, what do? You directly insert the guide wire, है ना? So it is not open to atmosphere for a larger duration of time, and it is not that you generally have got head low position for this. So for the air to enter with regards to your atmospheric pressure, there is a difference. It can happen, but it is not a common finding. All right. Next question on your screen. I'll give you 45 seconds because option bade hain. And I am expecting at least 80% of you to give correct answer for this question, okay? Which of the following is IV hypnotic agent? Sevo, Halo, Des, Fenta, Tramadol, Buprenorphine, Propofol, Thioetomidate, Clonidine, Dexim, and Adenosine. IV hypnotic agent. So first of all, let me clear the doubt of the 21% of your students जिन्होंने बोला है Sevo, Halothane, and Des. What is the question asked? Question is asked about IV, right? So option A to ruled out. Okay, these are what? These are your inhalational, right? These are your inhalational. So almost 9 people of you said that it is emotional. 9 to 10% of you. Okay? So you clear? Is it clear? So option A is ruled out because this is inhalational. Rest of the 3 are IV. Let us discuss that. Fentanyl, Tramadol, Buprenorphine, which class of drugs are they belonging to? Yes, Alia, this is opioids, right? This is opioids, right? So this is done. Propofol, thiopentone, etomidate, which class of drugs do they belong to? IV, yes. IV, induction, sedative, hypnotics, right? It is sedative and hypnotic drugs. Okay? So your answer has come down directly. What about D? Yes. What is clonidine and dexmedetomidine? What are those? These are your alpha 2 agonist, right? Very, very highly important, because you will see these are coming day in and day out in your options, right? These are anesthetic adjuvants, right? These are anesthetic adjuvants in ICU. They are being used right now, left, right, and center for conscious sedation. Remember that, okay? All right. So yes, Preeta is asking, are anesthesia notes written by you on Unacademy? No, Preeta, they are not written by me. Okay? I have just given my input somewhere for that, but I have not written the notes for that particular thing. All right. और भी कोई question है? Let me see. This question is of PYQ. Yes, Imran. This is a question which was asked in the previous year's question, that is December 2021. So automatically this becomes a very high yield question, right? Kept happiness is giving all of us a mnemonic about your IV induction and hypnotic sedative agents, that is ketamine, etomidate, propofol, and thiopentone, right? We just go in the opposite order, that is thiopentone, propofol, etomidate, and ketamine. Kept is a very good way to remember all the things, right? इसमें और दो चीजें addition आएगी that we will discuss when we discuss the questions. Next question coming up on your screen. I'll give you just 30 seconds for this question, right? It is very easy. And again, this is a previous year question. And we are not even going to discuss this question, right? We are just going to move on to the next question. I'll just show you the image, one image after this, and we are moving on to the next question. 97% of you have given correct answers. That is extremely cool number. Great, guys. Moving on. What is this? What is this image? Identify in your comment section, all right? In your comment section. Or shall I start the poll again? What is this particular? Previous wala MPC classification was there. I agree with that. What is this? Yes, exactly. Poll start karu. Chalo, everybody has seen the image. I'll start the poll for 15 seconds, all right? I'll start the poll for just 15 seconds. Be quick, be quick. Image देखा है सबने पहला वाला है ना? A lot of you have already given the answers in the comment section, right? So 100% of you should be able to give correct answer. So this one is your Malampati classification. Everyone knows mouth opening and all those things are seen. What are the structures? This is a Cormack-Lehane grading or Cormack-Lehane classification. This is done after DL scopy, like under direct laryngoscopy. What all are the structures with the glottis visible? Okay, clear everyone? Moving on to the next question. And your time, I'll give you 30 seconds for this, all right? Spinal cord in adult terminates at. Is the question difficult or the options difficult? Because the kind of answers that I'm getting are really, really variable ones. Question तो easy लग रहा है मेरे को यार, है ना? 44%. Alia, how many questions done till now? Let me give you the answer. We are done with 6 questions till now. All right. So Dr. Jesse, Asha, Abhi, Chandrika, Shushma, all of you are standing at 10 percentile, right? Let me see how many of you all are able to maintain this position till the end. Well done. Koilosite, Manisha, Archie, Saif, and Dr. Dharmendra. Today we have got a very close contest. All right. Let us see how it goes till the end of this session. So this is, we are done with 6 questions Alia till now, all right? So spinal cord in adults terminates at what level, right? Options difficult. Hai? Upper end of L3 or upper end of L1, lower end of L3 or lower end of L1. First, let us be clear. Adults has got something to do with L1, and children or pediatric have got something to do with L3, right? So option A or option C to rule out कर देते हैं, right? So we are left with just option B and D, right? Of this, we will choose always the safer option, that is lower end of L1, right? In anesthesia or in anatomy textbook, somewhere in some textbook it is given upper end of L1 as well. But from the anesthesia point of view, we'll always go with lower end of L1. Why? Because of the safety feature, safety margin, right? Some people have got lower end of L1. We always go ahead with our safety feature, right? So best answer here is, best answer I'm telling you is D, that is lower end of L1. Okay, everyone clear with this? Next question. Next question. 30 seconds have already been started. Last 8 seconds. And the time's up. I can see 59% of you have given correct answer for this question. On which principle is the following device functioning? All right. So what is the device name? Anybody in the comment section? What is this device, guys, that you are able to see with different colors? It is Venturi, right? It is a Venturi. Venturi mask is the correct answer. So this is what, this is a oxygen delivery device. Everybody is clear with this, understanding the basics of this. It is used to deliver oxygen, right? So there are two things we have seen yesterday, right? One is with variable FiO2, right? And one was with fixed performance or fixed FiO2. So this particular Venturi principle or Venturi mass comes in this fixed FiO2. That means whatever the color you choose, whatever is the FiO2 written on that, that will be delivered to the patient. ठीक है, इतना समझ में आ गया? वेरिएबल FiO2 वाले कौन से हैं? Nasal cannula, face mask, right? This will, why we are calling that variable FiO2? It will depend upon the breathing pattern of the patient as well, right? But with this Venturi, हमको अगर 60% देना है तो 60% FiO2 ही जाएगा. Therefore, it is called fixed performance, not variable. इतना ठीक है? Now, the principle on which it functions is a Bernoulli's principle, right? To tell you in short, we don't have to understand the principle correctly. एक बड़ा pipe है, one enlarged big wide bore pipe is there and one small bore pipe is there. When the water flows from the wide to a narrow bore pipe, what will happen? The pressure and the velocity increases, है ना? हमने देखा है ना, when we are watering in the garden, right, with the pipe, when we want to make it go far, what do? When the water we want to go far to that last plants, we just press it on that, right? We just press it like this and it goes far off, right? So what is happening? Velocity is increasing and the pressure also increases. That is basically a Bernoulli's principle. Okay? Alia, most of the times I do take an effort to like take the daily classes, I mean daily special class, but it varies, you know? And everything is updated. If you are following me on the Unacademy platform, if you follow me there, you will get the updates, or on our Telegram channel or on the community I am posting every time, right? So this is a Bernoulli's principle, basic, easy answer. Moving on to the next question, guys. IV anesthetic agent of choice for cardiac patient. IV anesthetic agent of choice for cardiac patient. 41%. चलो ये क्वेश्चन को मैं थोड़ा घुमा के पूछता हूँ, राइट? IV anesthetic agent which is most cardiostable, right? IV anesthetic agent which is most cardiostable. Again, I'll start the poll, 15 seconds only. I am not gonna change the options. IV anesthetic which is most cardiostable, right? I am just deleting this for the time being. Let me see. Same options, but the kind of question that I asked, the naming conventions are different, right? So cardiostable, what are the parameters that we have to take into account when we are estimating the cardiac function? Heart rate, blood pressure, right? These are the two parameters. Right? So what happens with propofol? What happens with propofol, guys? What is happening to the heart rate and what is happening to the blood pressure? Blood pressure decreases, heart rate may or may not, right? Heart rate may or may not, right? Blood pressure decreases. Ketamine के साथ क्या होता है? Heart rate is increasing, blood pressure is also increasing, right? Yes, Archie. Yes, exactly correct. Jesse, yes. What about sevoflurane? Sevoflurane, is it an IV or inhalational? It is an inhalational, so sevoflurane ruled out, right? No need to even discuss that here. What about etomidate? Etomidate causes increase in heart rate or decrease in heart rate? No effect on heart rate and no effect on blood pressure, right, guys? No effect on heart rate and no effect on blood pressure. So instead of Sevo, let us discuss thiopentone. Thiopentone causes increase in heart rate or decrease in heart rate? It causes increase in heart rate but decrease in blood pressure. Clear? One chart, very important chart, guys. Make a note of it, right? Try and write it if you have got time now, or take a screenshot and make sure that you write it there along with your notes, right? So CVS parameters may, what is the effect of IV anesthetic agent? This is the very important chart. So which is the most cardiostable IV anesthetic agent? Etomidate. Clear? Yes. If the patient is hypotensive, whatever it is, most cardiostable is etomidate, no effect on heart rate and blood pressure, right? So ultimately, what will be the choice of anesthetic agent if the patient is cardiac patient, right? Etomidate. All those who have mentioned ketamine, ketamine can be used in cases of shock, right? But is it a drug of choice? No. Always the drug of choice in any cardiac condition is etomidate. Make a note of it, right? Make a note of it. Clear, right? I hope your this doubt is solved now forever. All right. Moving on to the next question. 45 seconds for this. All right. "45 seconds for this question. Last 15 seconds on the clock. All those who have answered, tell me what is the rhythm, guys. Identify the rhythm in the comment section. All right, so time's up. 64% of you have said. Saif is telling it is a shockable rhythm, but what is the rhythm? Manisha says it is VF. Ashutosh says it is VF. Yes, Jesse says it is VF. Yes, all of you are correct. It is VF, right? So Saif says it is a shockable rhythm. So guys, tell me which are the shockable rhythms? Which are the shockable rhythms? VF and VT, right? So VF and VT are shockable rhythm. Therefore, this comes in shockable rhythms, right? Now, what has happened? The office colleague has collapsed and ambulance is called for. ECG was taken. मतलब ambulance आ गया है. Ambulance में ECG लिया. So we are getting this particular ECG. This is a VF, ventricular fibrillation, right? So next line of treatment, since the patient has collapsed, means there will be no pulse which will be felt. So you have to start with chest compressions and give defibrillation as early as possible. Option B, correct answer, right? Checking for pulse and rhythm is already done. Therefore, we called ambulance, because the patient has collapsed. Cardioversion, it is usually done when the patient is stable, right? The frequency, all those things are stabilized, and VF में cardioversion नहीं होता है. It usually happens when we get those QRS complex. It is usually synchronized with that. ठीक है? Patient in left lateral position and observe. It is usually done when the patient is in post-ictal state. To maintain the airway, this is known as safety position. So option C is also ruled out. So all 4 options we have discussed in detail. Okay? Yes, Teresa, did you mark this answer correct or incorrect? Then this was a December 2021 question. So did you mark it correct or incorrect? Wonderful, Teresa. So these are your building blocks. You know? Next question.